I'm Dr. Hostin from Bannockburn Chiropractic, and this is part 2 on my talk about sciatica. In the first video, we talked about causes of sciatica, what sciatica is. In this video, I want to talk a little bit more about the intervertebral disc complex. This is a motor unit. It's comprised of 2 vertebral levels plus the disc in between. This is the space where the spinal cord runs. If we tip it and look on the sides here, you can see this little hole that's called the neuroforamen. The neuroforamen on each side is where the nerves exit the spinal cord. This is where the nerve root is, and this is a common area for impingement or irritation that causes symptoms down the leg. So even if you have symptoms in the leg and you feel it, sometimes just in the foot, it's usually coming from here, or at the very least, this needs to be ruled out the best that we can with an examination. The disc itself is comprised of the inner portion, which is soft. The outer portion is a tough fibrous ring called the annulus. With a herniation, there's a tear in the annulus, those outer fibers. The inner portion, the nucleus pulposus, leaks through. It can go sideways or it can go back, which is towards the spinal cord. A disc herniation is just part of the picture, though. What is most important of all is how you function and what your symptoms are. Studies like this back up what I say. Just because you have a disc herniation doesn't mean you're broken and that you can't get back to doing what you want to do. This study found that on MRI, as we age, people had all kinds of findings with no symptoms, including disc bulging, protrusion, central canal stenosis, disc degeneration. Treatment options can vary, and it's important to exhaust all conservative treatments first, barring any red flags. And red flags can include things such as worsening neurologic symptoms pretty quickly, including muscle weakness, changes in bowel or bladder habits, or sexual dysfunction. These things are more rare, which is why the usual course of treatment is conservative. That can include medications, that can include steroid injections or oral steroids. Obviously, on the other end of things is surgery. But getting you in a better place, moving better, and getting you to function with movement over time better and better is also important. And that's what I want to talk about in the next 2 videos.